All right, I'm so excited to introduce to our community today Dr. Nami Patel, holistic dentist, best-selling author, speaker, global health advocate. Dr. Patel uses functional dental medicine principles to treat not just the mouth, but the whole body, which I think is so interesting. Her work has been featured in Forbes, ABC, NBC, CBS, Fox, and many others. She's also the best-selling author of Age with Style, your guide to a youthful smile and healthy living. So excited to have you today. Welcome.
Thank you for having me, Lindsay. I'm so excited to share all this great information to the listeners.
Yes, I'm thrilled. Do you know we're on episode 350, something in there, and we've never had a dentist on the show before. And
Wow.
I know, and I think we're missing out as I continue to learn more and more from you. And I'm excited to bring that to our listeners today. So I'm going to start with this to just pull you in that I would venture to say most of our listeners, when they go to the dentist, they expect nothing more than how am I looking? Any questions? Do I have any cavities to worry about? So pull us out of that space and into some higher expectations.
Well, yeah, I am so excited to talk about this. So, traditional dentistry has been all about, hey, cavities and fillings, and that's pretty much it, and brush more, right? It's like if there's ever a problem if you got a cavity, it's like you're not brushing your teeth, and that's really actually so outdated because science has come such a long way. So, I grew up in Ayurveda, which already knew the mouth was the beginning of all sorts of stuff. We talk about leaky gut, leaky brain, but hey, it starts with the leaky mouth. And really understanding science has actually proven that, which has been really great to realize your oral microbiome is so important. We now know the specific bacteria that can cause heart attack, diabetes, cancer, Alzheimer, arthritis, and so many other chronic illnesses. And it's just been so wonderful to be able to see science back this up because Ayurveda has been saying this for thousands of years. And Chinese medicine, too, they diagnose you from your tongue. But now that research has been around and we can actually test this stuff and really do data-driven information, and it adds a whole different layer to functional dentistry, which is really awesome because we want to test, we want to know, we want to treat with confidence. We want to know with confidence what's going on and what are our biomarkers. So, no feelings, real fast data that gives us a really good segue into what we can do to live longer and also prevent disease, which is really important.
I'm loving where you're going with this from the standpoint of I think a lot of people, when they go holistic or integrative, I say this word a lot on the show is woo woo because I want to catch somebody else before they say it coming out of their mouth. Like, and you're like, no, it's facts, it's research based. We are coming out of, we can actually take somebody's opinion about woo woo and bring them into the research and prove it otherwise. So, can you, for the person going, what would make me interested in this? Why would somebody want to walk through your doors and learn about some of their system, their mouth, what they're trying to prevent?
Absolutely. So, number one thing I always like to say, Lindsay, is I want to comment on the woo-woo stuff. And that woo-woo is because they haven't done the homework.
Hmm.
It's like if you're not an expert in your field, if you're not an expert, we have so many medical doctors as well that refer to our practice because they have now seen, hey, the chemo works way better when we're cleaning their mouths properly. We're finding that chronic illnesses are being cured faster. Adrenal fatigue is getting cured faster because of the work that we do. And the biggest thing I always say is dentistry is not a stepchild of medicine. Dentistry is part of your mouth. So let's start there. And they're connected. Number one. Number two, we're looking at biomarkers. We're looking just like a medical doctor looks at your blood work and says you need A, B, and C or you're healthy. We're actually looking at saliva, which is dentistry's biomarker. And testing for cortisol. We're testing for interleukin 6, which is how your body actually works. And actually looking at what is actually happening. And also, is the treatment we're doing effective?
Mhm.
Because it's no longer just about scraping teeth. We need to start adding probiotics. We need to add, sometimes vitamin D, calcium, K2, just a lot of different things that your body actually needs for optimum health. And the other thing I want to say is that for the listener sitting out there, why start at the dentist? Well, the number one thing is when you go to the medical doctor, their goal is to make sure that you're not dead. That's reality of it, really. Now, the dentist is looking at, and how I work is I'm looking at preventing disease. Science has discovered that it takes 13 years for disease to occur. It's not like people just get sick like this. Sure, you'll get a flu or something like that. Even with cancer, we have cancer cells every single day. Our body actually gets rid of them. When cancer becomes problematic is because our bodies are not able to take care of those cancer cells anymore. And that actually happens because there's an environmental trigger, there's a gene expression, or there is something like stress will do it where your immune system is not working as well. So there's something that's contributing. And so often business, people look at cause and effect. Or your bank account, we look at cause and effect. If you stop spending, you're going to save.
Mhm.
And then if you invest properly, your money's going to grow, right? There's some cause and effects that actually happen. And that's what's occurring with dentistry. And that's what we're doing is we're looking at the cause and the effect. Let's say you started with very common thing I see in women, especially menopausal women, is that there is a lot of dry mouth because of hormonal changes. And people sometimes, or women just think it's actually normal because it's part of the menopausal process. And it is part of the menopausal process. However, when there is that dryness in the mouth, it actually makes those bacteria overgrow that I mentioned to you. And without intervention, it actually leads to disease. So, and the interventions can be very simple and easy, like making sure that there is a dry mouth mouthwash that we're adding to the repertoire on a daily basis that can really make a difference because disease in your 50s and 60s starts in your 40s.
Thank you for pointing that out. I think it's something that we kind of know or would maybe have said a couple years, but to click back 13 years and go, we could have been working on something. It's kind of very much how I feel in this menopausal, perimenopausal phase, is if we can catch it early and get things implemented now. And I've never thought about the mouthwash part of it, the dry mouth part of it. So that's like a whole nother element that if we stay ahead of it. And keep giving us specific examples like that because I think this is incredibly motivating. What's something else from the mouth ahead of time? Let's stick even with women that you've noticed if we can get ahead of.
The one of the other thing that I always see is hypothyroidism. We find that majority of the women that we find who have thyroid issues actually end up having upper airway resistance or sleep apnea, where their windpipes are too small. And so what that does is it happens from intervention as a child through braces or their sinuses not being developed properly. And we see that sometimes there's death, disease, or divorce, right? The three stressors. And those stressors occur and that increase the cortisol levels even more. And we find that the thyroid is actually diagnosed. And it takes about 2 years actually before hypothyroidism. We can actually go back and look at when did the symptoms start. Because when the symptoms start is not where the disease started.
Mm.
The disease started way before that. It's just that it was subclinical and our bodies were actually working on healing ourselves because that's its job is to maintain homeostasis, is to protect itself. So that's what it's doing.
Let's go a little deeper with that, the subclinical part of this, because I think somebody could go, I think I get what you're talking about. So you're saying maybe if I was, let's do menopause again, if I was starting to go, I'm a little sleepy or I'm a little bit more foggy than I used to be. Is that kind of where you're going with the, your body was probably talking to you, but you didn't listen for multiple years later?
Exactly, exactly. Let's stick with the menopause, perimenopause piece. The number one thing that happens to our body is as we get older, our body doesn't absorb as much vitamin D3. So if our bodies are not absorbing as much vitamin D3, we're not getting our precursors to progesterone, estrogen, testosterone. Let's start there. That's the fundamental basis. And 90% of the population is deficient in vitamin D3 is because We're inside, we're not outside like our ancestors were. So we start with that piece. And how does vitamin D relate to the teeth? And we actually see more cavities in patients when they have low vitamin D3. We can actually see the pulp horns be really pointy. So when you're going in for a regular dental x-ray or digital imaging, we can actually see these things, believe it or not. And what we do is we take it to the next layer, which is let's test you. Let's put you on some supplements and let's retest you to make sure your body is actually absorbing that vitamin D3 because of the MTHFR gene. There's so many different variables, ethnicity. So those would be first places that we would start menopausal, perimenopausal women. The second thing we always look at is going to be the oral microbiome, which we test. The third thing we look at is sleep. So we
Mhm.
will actually test your sleep to see, and I'm not necessarily just looking at sleep apnea. I'm actually looking at something called upper airway resistance. The reason I look at upper airway resistance is because at the age of 40, there's something that occurs to our body, our DNA, the way that our collagen fibers that are normally really tight start
Mhm.
loosening up because our
Yeah.
telomeres are becoming shorter. Our DNA is, that's how we age. So our bodies are naturally loosening up those collagen fibers. And I've got some really interesting news for you, Lindsay.
Oh boy.
Guess what the tongue is? It's full of collagen fibers because it's a muscle.
Oh my goodness. Yes, you're blowing my mind on so many things, by the way. Keep going.
So what happens is the tongue fibers start getting loose. So what usually happens first is just small just small silent mouth breathing starts occurring, beginning of dry mouth. Now, add that with deficiencies in estrogen, testosterone, things like that. It makes a dry mouth even worse. And
Mhm.
then you let yourself go from, like, let's say 40 to 50. All of a sudden, you're diagnosed with apnea. Your body is like, oh my God, if I'm not sleeping and rejuvenating, it's causing disease,
Yeah,
right?
right. Yeah.
And that's why there's certain things that happen at certain stages of life, and we have to be aware of how the mouth impacts it all. Earlier, I made this comment about a leaky gut, but let's remember the leaky mouth. That's what's causing the leaky brain as well. So we really need to look at the mouth because there's only several openings we have in our body where disease can start. You can eat some bacteria, sure, which happens to people, but a lot of it is actually conditions and environment that cause these bacteria to overgrow. Just like mold, black mold is we see it in tropical environments or we see it with the Pacific Northwest because it rains so much, or we're seeing it on the East Coast and again in the North as well as because of those long winter seasons. We're seeing certain things that are showing up in the environment that actually changes gene expression and causes disease. So our bodies are designed to work. They're an amazing computer or amazing machine, even better than AI. It's got thousands or millions of years of evolution and it's designed to work. But when there are certain things that take it off its game, that's when we have disease. And just like a computer bug, computer just doesn't shut down right away. It's if you don't do your Windows update, you'll notice that there'll be more problems. And that maintenance piece is really important. And that's really what I want to stress with is early detection,
Mhm.
early intervention, and really being ahead of the game and not waiting for disease to occur. But let's make sure that we are a society that is so intelligent. Let's utilize the resources we have so that we can have health because that's priceless.
Oh, so good. And to not overwhelm listeners, because here's where I think we've been so blessed in the podcast world to start really understanding this full picture of what our puzzle pieces look like from gut health to menopause to brain health, therapy, nutrition, fitness. It's not one thing, is what we're continually learning. And now we're learning the mouth has this huge portion of this pie. And I guess my question to you is for people who've already been working on pieces and parts, it's an easier transition to go. All right, haven't focused on my mouth yet. I need to focus on that. But for the person going, oh my, like I haven't done any of this and now it's another area to worry about. What's some of your comfy talk around just investigation and how we can, yes, maybe we've screwed up our health, but how can we get it back? Is there hope in this scenario? All of that.
Absolutely. Lindsay, that's a great question. The first thing I always like to say is somebody, if you're feeling overwhelmed or not knowing where to start, and first of all, it's okay. Number one, it's okay. The most important thing to realize is that we as a species have a lifespan. We're designed to die. And it sounds really morbid, but that's the reality of it. We're designed to have a lifespan. We can optimize it, and that's where we put our effort and energy and focus. Of course, you want to diet. Of course, you want to exercise. Those are the givens. Of course, we want to look at your blood work. And now, because we're in this wonderful society and because we have all this information at our fingertips, we can take it a step further and really look at the mouth as the origin. And if somebody's really overwhelmed, I would say just take a minute and breathe. You don't have to be. Don't be overwhelmed by the entire process as if something is a mess and something needs to be fixed. You're whole and complete. You don't need to be fixed. All you're doing is optimizing. And we are ready for certain things at certain stages of our lives and at certain times. So if you've got a lot going on, maybe not the right time to kind of focus on these things. Probably just want to focus on flossing, brushing your teeth, certain basic things like that. That's probably what you want to start with. And then let's take it a step further. Then you might want to go in for cleanings every 6 months. And then you can go a step further than that. Let's start testing a few things. And then you can take it a step further and say, okay, the microbiome looks good. Maybe we start looking at sleep. Maybe we start looking at vitamin D, B12. Then we start looking at Alzheimer's risk. There's so many layers to health, and there's so many layers to us. And the important thing to take home with this is start with one thing. Build a habit, make sure you feel really good, make sure everything works out really well. So that's probably where I would start, number one, and then work ourselves from there. But I would just start with step number one, which is just understand that we are a continuous quantum being and give ourselves some grace and start with step one. Just even learning about this is huge. As you and I are sitting here, I mean, this is a world of information you may not have heard of before. And just by you listening is huge because we've now opened your eyes into something that is microscopic and different and unique. And it doesn't have to mean something's wrong. It just means it's unique information, it's new information, and you get to choose to delve into it.
Beautifully said. Thank you. And thank you for laying it out how you did, because I think that makes it easy for the individual to see where they could jump in to this part of the equation. That for the person who's not going to their dentist every 6 months, like that's your first place to start. Like you said, or flossing, just back to the basics sometimes. I heard this once. Whenever you implement it every 6 months, have the most beautiful accountability system out of all medical professionals. If you think about any other medical professional, nobody else has their clients on such a consistent regimen. And so I think that's really interesting. If somebody's not taking advantage of that, that it's offered to us, that's a good first place to start. I call myself an accountability coach, and that's why the whole accountability piece resonated with me. I just feel like for the person who's going, I'm ready to investigate more. Your clinic's out of California, and I feel like obviously not everybody can get to you. And I feel like you're ahead of the curve. Do you feel like individuals can get to places like yours, or like what's your next referral recommendation, or are you available virtually?
Yeah, absolutely. We actually do a lot of diagnosis virtually. The reality is that we can help diagnose, we can help create a treatment plan, and we can work with a dentist locally to help you get
Mm.
the results you need because we do the testing, and the testing is the most important. We can ship the test kits home. We can do the testing. We can really evaluate what's going on. And hey, a lot of times people will come to San Francisco, make a week out of it. We're happy to see you in office. Let's get you cleaned up. Let's look at what's going on. Let's get you detoxified and really giving you a good foundation. So we can absolutely do that as well. But the easiest one I would say is let's start with some testing and we can do that virtually.
That's fabulous. And I love the idea of all that being virtual and being able to pair with a current physician somewhere else too. That's wonderful. And I'm kind of picturing for somebody who's hit some roadblocks in their health where they're like, you know what? I've investigated food sensitivities. I've investigated my hormones. I've investigated, and I'm still not getting the results I want to get to. Is this almost like your prime person of we're perfect for
Yeah.
you? Hmm.
Yes, absolutely. I always say there's three types of ideal patients for me. Number one is a chronically ill person, somebody who's had disease for a long time and can't figure out the root. Like, hey, I'm to no avail. I also have cancer patients. Those are really Alzheimer's as well, cancer, Alzheimer's, any sort of disease there. And then also biooptimizers. So if I'm 50 years old, I want to make sure that I don't get any of these diseases. And because they're just a natural part of the aging process that we really anybody, I would say 40 plus, 50 plus is ideal because we can really biohack you. None of this woo-woo stuff we were talking about. It's really let's get your VO2 max going. Let's make sure we got these bugs out of the way. Let's increase your 3D nasal volume so we get you all that nitric oxide where your body is fixing itself. So those are the ideal patients for me. But I actually have a lot of biooptimizers, a lot of patients who don't want disease, and I have a lot of chronically ill patients because they're like, I've gone to other people and I know something's wrong. They just don't believe it. The doctors actually tell them, hey, you're making this up, when in reality, you know how you feel. And it's really important to be heard. And we can get to the root of it for sure.
And how comfortable that is to finally have somebody listen and go, you're not crazy. You're not broken. There's just something that's not found or detected yet. And to have a pairing to do that. So thank you for stating all of that. I feel like I can't let you go without asking some questions as we age and people with bad breath and like your favorite products out on the line, things that you really find to be so helpful as far as do we have to just put up with some things or are you like, no, these are like game changer products?
No, absolutely. Well, let's start with the basics, okay? I love that question. That's so fantastic. So the first thing I always like to say, you need to floss first. So that's number one. If you don't like flossing, get a water pick. The water pick squirts water in between the teeth, so it'll get rid of the bacteria first. Second is a must is an electric toothbrush.
Mhm.
It hits your teeth with 30,000 pulsations per minute. That is faster than Superman. So that's number two. Number three is scrape your tongue.
Hmm.
So when you scrape your tongue, your body actually detoxes through your tongue because there's a lot of blood vessels in your tongue. So scrape all that out. You will notice bad breath will be so much better. You'll notice so many different things. So I would start with those three things first. The toothpaste I like to use is going to be Boka, Boka. It's cost effective. It has hydroxy nanoapatite. You can buy it on Amazon. Super easy. And also, I have a make your own toothpaste if you want to make your own toothpaste too on my website. You can check that out as well. So those would be the basic things that I would start with. And then if I wanted to add an extra layer, let's see if I was somebody who had dry mouth. One of my favorite mouthwashes is Stella, Stella mouthwash. It has a coconut oil mouthwash, which is really fantastic. It'll help hydrate the mouth. So it works really great. The other thing that I absolutely love is nitric oxide. So you can take like a beet lozenge and suck on it, especially menopausal women, dry mouth throughout the day, or if you're a podcaster speaking all day. So you can use a lozenge which stimulates your salivary glands, and that nitric oxide is really great to let good bacteria overgrow in your mouth, which is what we want because we want to increase the amount of good bacteria, decrease the amount of bad bacteria that exists in the mouth. So those would be my basic things that I would start with. The company that I love for the nitric oxide is Beat NO2. They are pretty fantastic. But any sort of beet lozenge is going to work really great. The other thing that works really great is a lot of zinc. A zinc lozenge is really great as well.
Hmm.
And a lot of menopausal women tend to be deficient in zinc, or a lot of patients with chronic disease also deficient in zinc. So that's really great to start there as well. And then I would say definitely mouth tape when you go to bed.
Okay. Yeah, interesting. I've yet to try that. I need to try it.
Yeah. I would say don't go buy the expensive stuff. All I want you to do is get some scotch tape that you have at home and just tape it vertically. Yes.
Mhm.
And make sure it's a little loose so it has give if you need it. But just start there. That's a great place. Just like we talked about the first step, just start with that first step.
And I will make sure I get everything you mentioned in the show notes. So if anyone's listening and running and you can't be jotting down notes, we'll get that for you. And also, if anybody is having things show up in their mouth, like tonsil stones or constant canker sores, would that be a first indicator of like something's going on? You need to check this out.
Yes, tonsil stones means your mouth breathing, so you've got an airway concern. So let's get you in ASAP for that. That's number one. Canker sores sometimes can be stress induced. So
Mhm.
I would say for canker sores, I say vitamin B is really important. So making sure you're having your good B supplements is going to be very important. And D's and B's are really important, especially if you're female. I say at least take a B50 once a week. Get all those B's in. They're so important in so many pathways. So really taking those is really helpful. But canker sores, I would say making sure we have our vitamin B's are really helpful. And stress management, which means that you need to breathe. That's the
Mhm.
best way that we can manage stress is 20 minutes of deep meditation, deep breathing, journaling, anything to just let all that stress go.
Are you hearing this, listeners? Like, thank you for coming back to that. I just feel like it's so easy for individuals that to want to go every different direction and ignore stress, where maybe start there and then let these other areas trickle in as well. But yes, it's such a big part of the picture. So, no, wonderful advice. What am I not asking you that you would be like, your listeners need to hear this?
Well, I would have to say that, yeah, I want to leave with this, and I feel like it might be another conversation we might have in the future. The first thing about dentistry is what's the one thing you can't live without? Air.
Air.
Right.
Yes.
And sometimes we forget that your tongue is part of the functional airway. And that's why it's beyond teeth. And so that's the one thing that I always say, and I invite to change our thinking process and really delve in deeper because we've always thought about teeth as pretty teeth or needing to chew. We've never thought about the mouth being so vital to our existence. We can live without water, we can live without food, but without air, you got 8 minutes and that's it. And that's why dentistry it becomes really important, especially the type of dentistry with holistic dentistry, functional dentistry. It becomes really critical is because it's the number one thing we need to live. And again, it's been a stepchild of medicine. It's been
Mhm.
something that's been overlooked. It's been something that we forget to think about. And even as dentists, they forget that unless you're actually diving in deeper through functional medicine and really looking at the pathophysiology of the body and how things work. So I would say 3 layers, definitely vitamin D3, B12, oral microbiome, and your functional airway. Those are the three critical factors that we really need to look at. There's other things like failed root canals and type of materials that are used in dentistry. So really being important to utilize non-toxic materials. And one would not think that there would be some bad stuff, but there is a lot of bad stuff. So being mindful of that is also really important in dentistry. But I would say let's start with the first step, which is, hey, dentistry is part of the mouth. There's a connection, and we want to take that first step to health. And that's really what I want to share with.
Yes, that's so perfect. Thank you for summing it up. That's always incredibly helpful. And the easiest place for people to come get more from you, where do you like to send people or even more messages like this? What's your go-to?
Well, there's two aspects. There's my dental office, which is www.sf as in San Francisco, green, green, dentist.com. That's one. The other thing that I actually have is also my own webpage, which is drnammypatel.com. That's DRNAMMYPATEL.com. I have courses that you can purchase if you want to dive in deeper. We have a ton of podcasts between both of the sites that you can listen to, so many blogs, so many different information. And then let's set up a virtual consult. I don't want to guess on anything. I like data-driven, personalized, customized treatment and direction. So I'd love to, whether it's figuring out the right probiotic or whether it's actually testing, let's figure out exactly what your case is so that you can lead with confidence. And that's my wish for you.
It's so good. So good. All right. And then you got to send our listeners out. If you could wrap your arms around them, just one thing, if you heard nothing else out of today, hear this.
If you got nothing else out of this except, let's see, the number one thing, there's so many pearls, it's hard to pick now. And we had such a great conversation here, Lindsay. Let's see, I would say I'm going to tie it back to you talked about accountability. And that accountability with the mouth, I would say, starts at home and starts with the first step. Floss, brush your teeth, let's test.
Nice and simple. This very doable. Thank you. You have been an absolute delight. I'm so happy that you joined us today. Come back.
Oh, thank you. I'd be delighted to.